Let me now, at this point, invite somebody to come and make a statement. Somebody who is changing the trajectory in the healthcare service delivery in this country. Somebody I normally refer to as a health diplomat, who have sojourned globally and contributed immensely to the global health. Somebody who is now at the helm of health service delivery. Somebody who is providing the dedicated leadership and direction and also controlling the way we are doing health business. Your Excellency, distinguished ladies and gentlemen, permit me to invite my Honorable Minister, Dr. Austin Dembi, to come and make a statement.
Good morning. I don't know, this is one day that we've been waiting for, and it's so wonderful to see it happen. The President of the Republic, His Excellency, Brigadier Retired Dr. Julius Maada Bio, the First Lady of the Republic, Her Excellency Fatima Bio, our ace in the hole, one of the big champions in the health sector, the Honorable Vice President, Dr. Mohamed Julde Jallow. I think between the three of them, we have an incredible partnership in the leadership of this country in the health sector. Thank you very much. With that said, Mr. Chairman, I'll ask permission to stand on existing protocols because I think we're running a little late. We have heard incredible accolades to our development partners who have been helping us at every step of the way. But this is a national summit, and as such, we have representatives from each and every district in the country. Please join me in recognizing the delegation from the Eastern Province. Could you all stand so we'll recognize you? Kenema, Kono, Kailao. Delegates from Kenema, Kono, and Kailao. You're very welcome. The delegates from the Northern Province, Bombali, Tonkolili, Koinadugu, Falaba, please stand up, let's recognize you. The delegates from the Northwest, Port Loko, Cambia, and Karine, please stand, let's recognize you. The delegates from the South, Bo, Moyamba, Pujaom, Bon, please stand, let's recognize you. Our hosts in the Western area urban and Western area rural, please stand and be recognized. We want to pay a special tribute to you, the health workers, because you're the ones that are going to make all of what we're talking about happen in the field. Thank you very much. These delegations are very broad. They include Ministry of Health workers, they include administrators of the district, they include the paramount chiefs in the district, they include civil society, they include our development partners. I think together, we will transform healthcare in this country. So my remarks today will focus on life stages. And His Excellency, for anybody to put together a meeting of this nature, usually it takes about a year or so, about 2 years to pull all of the pieces together. We started out with an idea. We pulled our partners in. We thought about it. We planned it. We have everybody hands on deck. And today, we're actually actualizing that vision, that dream. So I spent a lot of time in the US, and we know President Barack Obama used to say, yes, we can. And we just did it. Thank you. So can I have the next slide, please? I think you saw the slide before. Can I move it myself? You saw the slide before that Dr. Kennedy referred to, and I think it's really important for us to see the healthcare in its entirety and how it's structured. One of the things that I really want us all to remember is our healthcare system in this country is enviable. I think you hear a lot of negative stories, but it's because we haven't told our own story. It turns out in this country, 85% of the population have a health facility close to them within a 5-kilometer radius. 85%. Our challenge now is we've addressed the access issue. We have to supplement that with the quality of service that we deliver. So this meeting here is going to help us think through how do we convert access and build solid quality behind it. You could see a whole range of services from secondary hospitals to tertiary hospitals to district hospitals to community healthcare workers throughout the chain. It's this network of services that covers the whole country that we're talking about. So for us to look at universal health coverage, the fundamental principle is no one is left behind. When we talk of healthcare, it's healthcare for everybody. And what we're looking for is ensuring that there's appropriate and high quality service at affordable price. And fundamental to universal health coverage are two major building blocks. Primary health care that we've invested so heavily in this country, that's why you have close to 85% of the population are close to a facility. The secondary component to it is hospital services, which we're struggling with a bit, but we need to work on. But when you combine the services at these two levels, you have the active ingredient, the foundation, the pillars for universal health coverage, where no one is left behind. Again, we're inspired by this, by the President's vision for human capacity development. This is an essential ingredient for us to build that human capacity. Now, this is a new issue that we have to pay close attention to because people are asking, what's different? What's different? Dr. Kenneth told you about what we've been doing, what we've been trying to do. I think that's really very, very important. Because if we're saying we're going to provide health care for all, we should be able to see everybody. Nobody is left behind. And for us, the best way to do that is to follow life stages. By that we mean starting from the pregnant woman there, ensuring that every pregnant woman, the Ministry of Health has programs that are directed at the pregnant woman. We have specific services that are directed at the pregnant woman. We have clear targets that we've set ourselves and ensure that we monitor those targets. So as everybody has been saying, we've done pretty well to be able to drop maternal mortality from a few years ago, it was like 1,300 per 100,000 live births. In the Demographic Health Survey of 2019, we dropped it to 717. And by the medium-term development plan, we're going to bring it down to 580. But in our discussions with the President, we have said we're committed to drop this even further. Not stay at 580, but drop it at 300 and below. Because if we do that in the next 2 years, we're preparing ourselves for 2030, when the end of the SDGs occur, when they're asking everybody to go to 70 per 100,000. We're going to go below 70 per 100,000 by 2030. Trust me on this one. The important thing also is, if we monitor this pregnancy all throughout, our expectation is over the 9 months, we will make sure that this pregnancy is our pregnancy, our nation's pregnancy, till we deliver a young, healthy baby boy or baby girl. At this point, we want to be sure that the ministry has all of the programs that are directed at this baby. We have services that are directed at this baby. And we're not just going to do that like we always do, have policy documents and things. We're going to set ourselves ambitious targets that will look to make sure that this baby doesn't only survive, this baby thrives. And that's our commitment, that's our responsibility. We will stay with this baby till they go to kindergarten. And then we'll link up with our school health colleagues, make sure that there are programs for these babies when they get into kindergarten, make sure that there are specific services for them, make sure we have targets we set for ourselves to make sure that, for example, we reduce stunting from 30 to about 28% in the shortest possible time until this young kindergartner goes to primary school and secondary school. We want to be sure that we have programs for them. We want to be sure that there are services directed at them. We want to be sure that we set specific targets for them and we see them go through secondary school till they go to university. Similarly, we have programs for them. We have services for them. We have targets that we set ourselves all the way till they become senior citizens, ensuring that we have clear programs, clear services, clear targets we set ourselves. And in this case, I'll ask you, who is missing? Everybody is captured in these life stages. We're ensuring that the gender lens is impacted on here. We'll make sure that disability is impacted in here, but everybody. So my notion, my word to everybody in the ministry is, if you don't find yourself in here, we have a problem. You should find yourself doing something somewhere within this one page. Again, it's very difficult to explain the complexities of the ministry, but what I've done for you is to capture it in one page. So in order for this to be successful, we need building blocks, solid pillars on which universal health coverage will stand. First, we need to be sure that we have trained and responsive health workforce. That is really critical, that we don't only have the complement and the number of health workforce, that we have the right train, the right attitude, the patient-centered approach built into our program as a solid foundation. We want to be sure that there's a functional ambulance service that supports the Life Stages program. We want to be sure that there's supply chain associated with this. We want to be sure that there's equipment, supplies, and a maintenance culture to support this effort. We want to be sure that there's research, there's data and data analytics and information systems to support this. We want to be sure that there's health security to support this. And as Dr. Sati Kene mentioned, we want to be sure that we have drugs and regulations to be able to support this effort. In the bottom of all of this, we have to have health financing as a strong component, strong leadership, partnership, and collaboration as foundations to support our effort around life stages. So let me, this might sound a little abstract a bit, but let me just bring it down to just one column, the first left column that we said. We said we want to reduce maternal mortality from 717 to less than 300 in the next 2-3 years. How are we going to do that? As Dr. Kene mentioned, first let's start with teenage pregnancies. 14% of the mortality in our maternal mortality index is attributable to teenagers. How do we ensure that we remove this mortality amongst the teenagers? So, Madam First Lady, thank you so much for what you're doing in that space. But together, we could tackle this and change this narrative. And there's a formula for it. You know, we could work on sexuality education in and out of school. We could make sure that family planning and commodities are available to these young people everywhere that's accessible. And we want to be sure that if indeed there's pregnancy, we monitor and support that pregnancy, because a lot of the mortality there occurs because people try to terminate their pregnancies in the backyard and it goes bad, and by the time they come to the hospital, it's too late. We need to support this effort. So it's a 5-point strategy. That's point number 1. Point number 2 is we have 1,500 PHUs. And, we have community workers, over 9,000 community workers. We want to be able to make sure that these PHUs are fully functional with physical infrastructure, with drugs and supplies, with a full complement of health workforce, with the energy requirements to be able to deliver pregnancies and monitor pregnancies. And by the way, we've been working with DSTI to develop a new app that you could use to register your pregnancy. And when you register your pregnancy, you can even use a button phone for it. When you register your pregnancy, it will tell you all of the facilities within a 5 or 10 mile radius that will allow you to pick a facility of your choice. We will link you up with a healthcare worker. We will work with you. We will work with the community to make sure you have at least 4 visits, preferably 8 visits throughout that pregnancy. If you have blood pressure, we'll help you manage it. If you have diabetes, we'll help you manage it. We'll manage your nutritional status. We'll manage your HIV. We'll manage all of the other comorbidities that you may have, because our principal goal is to have a successful delivery. So we'll focus on that as number 2. And number 3 will be, as we work in these primary healthcare units, there are complex cases that we'll identify. For example, people with sickle cell, people that have major comorbidities, we'll identify them in advance, and we'll work with them. But at the same time, when you have complex cases, you want to have a robust ambulance service that's able to move people from the primary healthcare to the secondary and tertiary facilities as needed. So ambulance service, recapitalizing the ambulance service, digitization improvement, looking at decentralization, maintenance of the ambulances, and field supply is going to be very critical. So you start with teenage pregnancy reduction. We work with the primary healthcare units. We have a rapid transportation with the ambulance service, and that brings us into the secondary and tertiary facilities where complex cases will be managed. We want to be sure that in these facilities, they have the requisite infrastructure to deal with complex cases. They have the requisite technical, professional expertise, OBGYN experts, nurse experts, midwifery specialists to be able to manage this, have blood supplies, equipment, and human resources and drugs to be able to manage complex cases. And the 5th component in this strategy is data. We want to be able to have data in real time that will look at a national level, will look at district level, will look at ward level, chiefdom level, look at ward level, look at neighborhood level, so that I can sit in this room and open up my laptop and see where all of the pregnant women are in the country on a heat map. We know all where the safe deliveries were occurring. We know all where the problems are occurring. And we don't have to wait till the end of the quarter to make interventions. We will do it on a daily basis, and on a weekly basis, we'll sweep and make sure we send requisite support to where support is needed. So, the way we see this, just as an illustrative example, if you could see in this image, you have a pregnant lady who is our queen, who's out here to come and receive services. You have a community healthcare worker who's working very closely with her. You have a midwife who's there, who's helping monitor the pregnancy throughout that period, who will make sure if there's malaria, if there are nutritional issues, if there are sexually transmitted diseases, if there are cancers, if there are family planning issues. We deal with all of that during those 4 to 8 visits that we have with our pregnancy. This is indeed our pregnancy. But at the end, we know that if we do this right, in every village, in every community in this country, will have this kind of family with that million Leone smile out there looking at us. Sorry, the husband had gone to work, but this is a great family. Thank you very much.
I think he deserves more. When a Dembi of this type speaks, you see substance and professionalism. My minister, thank you so much. We are now getting to the high point of this occasion. Distinguished ladies and gentlemen, you may be a world-renowned diver. You may be the Michael Phelps, who have won several medals for swimming. You may be the world-class sailor, but you will never get to understand and know water than the fishes themselves that lives in the water. And so therefore, distinguished ladies and gentlemen, I am going to call somebody whose work in the health space has been recognized globally. And for that work, she was recently accorded by the title Champion for Hygiene in Africa. Somebody who has cautioned all of us, we the men, to take off our hands from those young girls. So at this point, distinguished ladies and gentlemen, it is now my pleasure to invite the mother of the Republic, the African champion, our First Lady, somebody whose only interest is the girl child, somebody who is well acclaimed for her work in the health space. Madam Fatima Mada Bio, First Lady of the Republic.
Thank you. Thank you so very much, sir. Your Excellency, the President of the Republic of Sierra Leone, my dearest husband, the Honorable Vice President, Dr. Mohammed Julde Jallo, my big brother, who I'm not sure whether he's fasting. He's a Fuller man. I'm a Mandinka, so me and him, I believe one of us is not fasting right now. The Honorable Minister, Minister Dembi, distinguished ladies and gentlemen, Mr. President, please permit me to stand on existing protocol. As we're here today to celebrate a milestone. Now I have a history with Dr. Dembi, and that history started in 2019. 2019, I had the opportunity to go to the United States of America, where I was invited by my eldest sister, dear sister Mariam So, to come to the Children's Hospital in Washington, D.C. to try and see how I can use my voice to get the American Children's Hospital in D.C. to look into our health problems in Sierra Leone. Now, when we went to the hospital, it was so amazing, and then I realized that it's one of the best children's hospitals in the whole world. And in this room, with different nationalities, different faces from India, China, America, Europe, and there was a black man sitting right in the midst of that. And that black man was Dr. Dembi. At this point, I actually didn't know who he was. And I went into this room very determined with my elder sister. And I was thinking, how do we move this hospital from America to Freetown? I don't think there's a plane in the world who will carry that hospital to Sierra Leone. But that was my intention. I wanted to talk to the world. I wanted to talk to the world about the plight we are facing in Sierra Leone. And I'll come to why that has been a passion to me, and by extension, His Excellency, the President. Now, in that room, I presented a case study and I told them about our situation. I didn't mince my word. Well, for people who know me knows that I don't know how to mix politics into the truth. So I told them, if you don't come and help us in Sierra Leone, we are all going to die soon, because our hospitals are so bad, it's unbelievable. Because at that time, that was the fact. Our hospitals were bad. I went to the PCMH during the Christmas in 2018, and I found 2 kids in an incubator. I've never seen anything like that in any part of the world. And I thought, you know what, this is my crusade, a crusade to talk about the health facility, a crusade to focus on nothing but bring the attention of the world to Sierra Leone about our health facility. Dr. Dembi was in that room listening patiently. And after our deliberation, I was introduced to all these big names. You know, when they say doctor, I look for the injection every time. And when we finished, my sister said, I have a dear friend and I want you to meet. And here comes this unassuming man in front of me. And the same man in that room. And my sister said, this is Dr. Austin Dembi. And I heard Dembi. I said, is he from Sierra Leone? My sister said, yes, because she expected that I should know. I didn't know. And then they told me, and I was reading about his history actually, like, oh my goodness. So I said to him, when are you coming home? And he just smiled and said, I'm thinking about it. So when I returned back, I said to His Excellency, I met a doctor. Would you believe it? This man works with the White House, work with this, that. When I finished, before I called the name, His Excellency said, are you talking about Austin Dembi? I'm like, okay, girl, shut up now. He knows him. But, Mr. Minister, I know I'm here to introduce His Excellency, who needs no introduction, so I'll be introducing you instead. You know. I want you to know the caliber of people I saw you with that day actually defined who you are, because you have to be very special to be among special people. And whenever I spoke, I noticed most of them will look at you as if they're trying to get assurance from you, which means you are actually leading the pack. And I'm saying to myself, I'm a black girl here. This black man should support me. But you know what? I am not only happy that you are now in Sierra Leone, where me and you will have to transform this situation, but that support that you gave there to me is here now, and it's my turn to pay back. So I'm very much happy that, well, I mean, I have to be honest also, the day they announced that you are the new Minister of Health, I was as shocked as the whole nation, because, you know, Mr. President, he just doesn't talk about things like that. And I just saw Minister of Health, Dr. Austin Dembi, and I'm thinking, is that the same Austin Dembi? But this time I refused to ask him, honestly. And when you came, I've said to you, I am not your nurse, I am not your doctor, because if you ask me or ask Mr. President, he will tell you, I have big mouth, and if you want to shut me up, just come with a syringe. Just a single syringe. I will not speak for the whole day. That's how terrified I am when it comes to needles. So your work and the work of all health workers is something that, no matter how we talk about it, we are not able to pay you people. The lives you save, the sacrifices you make, doctors, nurses, and teachers are people that we should always thank. Health workers all around the world sacrifices so much. They forget about themselves. When the COVID-19 started, we know how many health workers died around the world, America, Europe, where you have the best hospitals, health workers were dying as if they invented COVID-19. And that's the sacrifices you make to save people like us. You make that sacrifices for us to be on this planet and to continue to enjoy the earth. So I want to take this opportunity, sir, to say thank you to you, by extension, from you to every health worker and for every partner who believes in health development, and to everyone who believes that for a country to be successful, for a country to be a progressive country, you just don't have to have an educated country, but you have to have a country that has the right health facility to take care of its people. So, Mr. President, your agenda for education for this nation, your agenda for health services to our nation, and the opportunity that you have given us women to have a voice, your agenda on gender equality. And I'm so grateful this morning to see the little boy from Koinadugu. I remember the day that that video went viral in Sierra Leone. The first person to contact my husband was his elder sister, who is in America and a health worker too. His elder sister contacted him and said, "Have you seen this boy?" And that's the first time I realized that a president can also be a normal human being. Mr. President totally forgotten that he is the president and he was meant to go to the office. And I believe that the minister will remember that day, because it wasn't social media who contacted the minister. It wasn't PA or Scope. It was His Excellency himself who was so desperate to get that boy from Koinadugu to the hospital. And looking at him doing everything to save this boy's leg, asking every single question, and I was beginning to wonder whether his doctorate is actually one for medicine. Wanted to know whether we'll be able to save this boy's leg, by extension his life, and to see him walk on this stage this morning is just an amazing story. But then it shows that the president also is a father who do cares, because he could have watched that video and did nothing about it. But no, he refused to just watch the video. Instead, he acted on that video. So thank you, Mr. President. Now, my obsession with health services. I know most of you know, by the grace of Allah, as it is right now, we are constructing the 34 hospital, transforming 34 to become the biggest government-owned hospital in the country that is built by Sierra Leoneans. We've started a crusade, and again, make it clear, because, you know, when Fatima talk, everything, they mix politics in it. 34 is a military hospital. I'm not there because 34 is a military hospital or because my husband was a military man, but I know 34 serves this nation. From Ebola to COVID-19, I saw how the staffs in 34 sacrificed everything to save lives in this country. And they have a facility that was not adequate for the job they render to this nation. And it's for that reason that I ask His Excellency to support a cause so that we'll be able to transform the 34 hospital. As of today, I can boastfully stand here and say a 100-bed pediatric ward is ready to be handed over soon. An administrative building will be ready by the end of this month. a nursing school, because there is no need of building a state-of-the-art hospital when you do not have a nursing school that trains nurses to be qualified nurses to work in those institutions. The nursing school also will be ready by the end of this month. We are doing a 100-bed women's ward, a 100-bed male's ward, all dedicated wards for themselves. And the actual reason why I went there is because of my campaign, the Hands Off Our Girls campaign, because I know for the campaign to be successful, for my voice to mean more to our girls, because I know my voice resonates in the ears of the men today. But for the girls to know that I actually meant what I am saying and that His Excellency is back in the process, we need to have a state-of-the-art one-stop center. Now, 34 Hospital gave us the land to be able to build that state-of-the-art one-stop center, which is ongoing right now. And in that one-stop center, every facility from the Rainbow Center to social worker to the police to the lawyers, doctors, wards, safe homes, everything will be under one roof. So when a victim enters our center, they are protected and their perpetrator will not victimize them again. We will protect them. That is ongoing, and we are hoping that by the end of this year, we'll be able to hand that over again to the nation. This is a project that has nothing to do with funding from the government of Sierra Leone. This is a project that myself and His Excellency are championing through the Mada and Fatima Bio Foundation, and we said we want to build this and hand it over. So please, when health workers, when health people come to you and they ask for help, if it's for health, it is for wealth. If it's for health, it is for development. If it's for health, it is for education. Give them and give as much as you can, because together, it is only together we'll be able to transform our health facilities and make them the facilities that me and you will want for ourselves. We live here to go to England and America. I am terrified of planes. Unfortunately, I find myself in a job where I have to travel, but I'm terrified of planes. But I know with Austin Denby here, I don't have to run to England, because I go to England after Sierra Leone. England is the only other country that I know. I lived there for 20 years, so I should know. But I know the facilities that are there can be brought here. And I know through you, the possibility of us having that is now becoming to be reality for all of us. I want to say at this juncture, there's no need to introduce the man who has given me the voice, and the man who has given me the space, and the man who has built my confidence, who had made me understand that I do not have to ride on his title as the president of this nation, but I can stand on my own as the first lady of this nation. Ladies and gentlemen, please help me welcome His Excellency, retired Brigadier Julius Madabio.
Let's sit down, please. Thank you very much, ladies and gentlemen, Mr. Chair, the Honorable Vice President, Ministers, Madam First Lady. That is a grave and unpardonable mistake. Ministers of Government, Honorable Members of Parliament, members of the Diplomatic and Consular Corps, our great development partners, mayors of municipalities, our traditional leaders,
our healthcare professionals present here today, distinguished ladies and gentlemen, good afternoon. I want to start off by saying thank you to the medical professionals who have saved the leg of that young man Madam First Lady was talking about just now. I saw the video and I could not watch it the second time. All I had to do was, I said, call me the minister. Wherever he is, that little boy, he must be tracked down and brought to Freetown, and let's do something about his leg. That was how we were able to save that leg. I followed the debate, of course, whether it was to be amputated or to be saved as they have done. And I'm very much impressed because the bone had been out for more than a year from my inquiry. I've not had the opportunity of seeing him until today. I'm very much impressed with what we've been able to do. You know, no child should go through that sort of torture, trauma alone. And that was why I decided to take that initiative. Thank you very much. The Minister of Health was actually the person who was, he went there almost every day at the hospital. I think he has not spoken to me, and he didn't make it possible for me to see my patient until today. I've listened to so many stories of loss, fear, anxiety, and of joy. Today, ladies and gentlemen, I will focus on an indicative story of joy. There's a story about a young mother at Moyamba Junction who beamed with pride as she held her newborn baby in her arms, surrounded by skilled health workers in a well-lit community health center. The child had lived. It was the first time she had ever delivered a child at a community health center. She had been brought to the hospital by an ambulance in the national ambulance fleet that serves her village just outside Moyamba Junction. 3 years from then, that child will attend an early learning center at Moyamba Junction that I commissioned late last year, adjacent to her mother's retail store. What a pleasure. 5 years from then, that child will attend primary school, free tuition or tuition free, be provided with teaching and learning materials by the government of Sierra Leone, be fed with nutritious meals, and he will be taught by highly skilled school teachers, or by courtesy of the Republic of Sierra Leone government under my leadership. She will live in Moyamba Junction, a town that has in the past 4 years had a paved high-grade highway to Moyamba and all outlying towns and villages. A town that now has off-grid solar electricity, potable water, and much improved schools, all courtesy of the New Direction government. Ladies and gentlemen, exactly 3 years ago at TED Talk in Vancouver, I told the world that I wake up every day, and this was exactly what I said. I wake up every day believing that our country should no longer be defined by the stigma of the past. The future offers more hope and opportunity for all of us. It matters more to me that young men and women all across this country can imagine for themselves that they too can be and are part of this story of our nation. I want to challenge them to build a country where 3-year-olds like my daughter Amina can grow up with good governance, quality education, healthcare, and good infrastructure. Ladies and gentlemen, this is the challenge to which we should continue to rise. This is how we change the story, or we can change the story of our own nation. This year's theme, health promotion for well-being, equity and sustainable development, resonates with the goals of my government's manifesto commitment set 5 years ago, and outcomes we describe and have been working towards in our medium-term national development plan. It also aligns with international commitments we have made to work towards universal health coverage and sustainable development goals. So let me, at this point, start by thanking our development partners, all of you. It's a long list, so I'm not going to attempt. Friends, policymakers, leaders, but most especially our health professionals in Sierra Leone. Thank you for a great job. Health professionals right across this country for believing in and supporting and working assiduously towards our collective vision of improving health outcomes and providing equitable access to affordable quality health care. Of course, we have challenges, as was depicted or illustrated in that little drama, but we can overcome those challenges together if we want a new nation for ourselves. That is the challenge. Again, I challenged at the TED Talk in Vancouver that the most audacious and nation-changing events or policies or even personal choices happen when we ask the question, why not? Then make bold choices and ensure that those bold choices happen. We, as a government, made a bold choice to improve human capital development of Sierra Leone. We asked ourselves, why not get an improved healthcare delivery system, set priorities that are sustainable, fair, and deliver health outcomes that close health disparities? We asked, why not reduce maternal and child mortality? Provide malnourished children with nutritious meals. Why not reduce the incidence of malaria and other disease burdens? Increase vaccination and immunization rates. We asked, why not recruit and train more healthcare workers, raise their pay, and provide healthcare workers with health insurance and improved service conditions? We have asked, why not deliver improved mental health care and enhance services to persons living with HIV, TB, and leprosy? Regularize the delivery of drugs through a new drug supply agency, upgrade healthcare infrastructure and labs right across the country so one is available to every Sierra Leonean within a 5-mile radius. Enhance and expand a national ambulance service. Why not develop a focused and strategic plan and health sector policies? Restructure our disease surveillance systems and successfully fight off epidemics and pandemics? Why not operationalize an affordable health insurance scheme? Introduce an innovative national health on wheels scheme? Revamp the leadership and rework the future of healthcare delivery in this country? And work with the private sector on new infrastructure and other investments. All of these we have achieved, and even more, because we asked the question, why not? These are irreversible and indelible gains that have saved lives and stand above trifling political rhetoric. The gains are about improving the lives of Sierra Leoneans. And this is because we asked ourselves, why not? And we are delivering on that question. Let me at this juncture acknowledge here that these gains have been achieved with technical advice, resource mobilization, and the goodwill of partners and friends, some of whom are here today. And permit me to single out the Global Fund for their 160 million grant to support the fight against HIV, TB, malaria, leprosy, and for improving health management information system digitalization. Also, I want to thank the World Bank for their grant of 60 million for strengthening health systems in some of the poorest, health-deprived areas of our country. We should also thank the government. See, I'm asking you not to thank me. And the people of the People's Republic of China for their support through COVID-19 and for their recent donation of 4 fully equipped mobile health clinics that we expand healthcare coverage to more areas of our country. To our implementing partners and every development partner that has built health clinics, helped train health workers, provided vaccines and healthcare equipment, promoted women's health, and supported nourishment and feeding programs at no cost to government. Thank you. To you, we owe a debt of gratitude. We are doing our part as a government. And as the government has increased the healthcare budget, and we soon spend in excess of 70 billion in an infrastructure upgrade of 100% of all major hospitals across the country, irrespective of region. We remain focused on WHO's interpretation of universal health coverage goals that, and I quote, all people and communities can use the promotive, preventive, curative, rehabilitative, and palliative health services they need of sufficient quality to be effective, while also ensuring that the use of these services does not expose the user to financial hardship. End of quote. In spite of our gains and our aspirations, we are mindful of persistent challenges that we will continue working hard to resolve. We believe we have the essential elements in place. Leadership and governance reforms of the health sector are ongoing, as you might have noticed. Our National Medical Supplies Agency continues its salutary work of distributing essential medical drugs and supplies in a timely and predictable manner, as was alluded to. We are investing extensively in health workforce training and service delivery. We are experimenting with innovative health service delivery models. We are optimistic that we will get there together. We are eager to work with partners and friendly nations to install advanced diagnostic equipment and cutting-edge health care technologies around our facilities. Integrated health management and information systems are critical for supporting our treatment and referral systems in our country. New private investment in pharmaceutical production are most welcome, and we are ready to provide generous incentives to facilitate the establishment of those production sites in this country. That is for potential investors. Ladies and gentlemen, let me close by challenging all of us to reimagine the future of healthcare in this country. Let us imagine a future of accessible and affordable quality healthcare for every Sierra Leonean and plan and work on making that happen in our time. As you dialogue during this health summit, let us believe that our shared goals are possible. We must therefore stay fully engaged and focused on improving health outcomes for every Sierra Leonean. That is the challenge. I want to thank all of you and wish you a fruitful deliberation during this summit. Thank you all.